right, without further ado, we'll go ahead and get this conversation started. If you're in need of ASL interpreting services this evening, please feel free to pin the interpreter to your screen. In addition, the live transcription is enabled, and you can turn that on by clicking the closed caption symbol on your control bar. With that, good evening. It's my honor to welcome you to tonight's Conversation 360, COVID-19 Vaccines and Disability. Tonight is hosted by disABILITYsa, a local nonprofit organization working to educate, advance, and engage individuals with disabilities while strengthening the disability community of San Antonio. Together with numerous community partners, we strive towards a vision to make San Antonio the #1 community where people with disabilities want to live, work, learn, and play. The Conversation 360 creates an open and safe platform for an interactive dialogue on the issues that individuals living with disabilities in San Antonio face that create barriers to inclusion, independence, and a more equitable quality of life. These discussions create a dialogue for improvement, identifying ways in which San Antonio community can take action toward filling the gaps, creating awareness, advancing public attitudes, and creating a community of inclusion for all residents. Tonight, we gather together to openly discuss the benefits, challenges, barriers, and pathways to engaging in the San Antonio community while addressing the way each topic impacts our lives and neighbors who live with a disability. Tonight's Conversation 360, we will connect the community together to discuss the barriers, myths, concerns, and service gaps that exist for people living with disabilities and the solutions, facts, and resources available for our community. This Conversation 360 is a part of a series of discussions through the disABILITYsa Vax-abilitySTRONG program, working to engage participants in community discussions up through the summer. I'd like to start us off with a few introductions. And I'll start with the disABILITYsa team. The Vax-abilitySTRONG program would not exist without our Vax-abilitySTRONG program manager, Annette Paulin. She's worked hours and tirelessly to make sure that we get these conversations set up and that we coordinate the awareness and the campaign and the vaccination clinics that we have available. Our program director is Lisa Santoyo, and she will be taking over partway through the Q&A this evening, so you'll get to meet her. And then behind the scenes, of course, is Janice Perez, our admin support specialist, who is not with us this evening, but has had her hand in making preparations for all of these conversations we've been putting on. I am Melanie Coffin, and I'm the executive director for disABILITYsa. And it's my pleasure to introduce our panelists for the discussion this evening. First off is Carrie Carr. She's our Senior Advocate and Outreach Manager with Disability Rights of Texas. Carrie holds a master's degree of science in rehabilitation counseling, and for over 23 years, she has conducted outreach primarily in rural communities and has served as a legal rights advocate for individuals with disabilities, conducting investigations, negotiations, and providing training to community partners and individuals with disabilities. Next, we have Ashley Lebaye. She's the program director for the Autism Treatment Center of San Antonio. She's a board certified behavior analyst and the ABA program director. She graduated from the University of Texas, San Antonio with a Master's of Arts in Special Education and a concentration in Applied Behavioral Analysis. She has worked as a BCBA for about 5 years, specializing in decreasing challenging behavior while increasing socially appropriate behaviors. We have Danielle Howard. She's a health program specialist with the ISA program for the Metro Health Department. ISA is short for Immunize San Antonio, which is an established coalition that has been promoting immunizations in diverse populations across the lifespan through collaborations in education since 2007. Collectively, the team works to move forward since the pandemic to restore efforts of the ISA program while working with other coalitions and partners to determine how best to support the needs of our communities. Then we have Antonio Martinez. He's a health and wellness coordinator with the IDD Services Department of the Alamo Area Council of Governments, also known as ACOG. Antonio currently oversees multiple programs that aim to improve the quality of life for persons with IDD and their families. Derek Nicholas joins us this evening as the Public Information, Education, and Training Group Manager for the Texas Department of State Health Services Immunization Section. Related to the subject of COVID-19 vaccine education within diverse communities, his group partners with Texas A&M University Health to administer the Texas Vaccine Outreach and Education Grant Initiative. And we have Dr. Junda Wu. She's the medical director and the local health authority for the San Antonio Metro Health District. Dr. Wu received her Doctor of Medicine degree from the State University of New York and has completed a residency in obstetrics and gynecology at Baylor College of Medicine. And with that, I'm going to hand it over to some of our panelists this evening who would like to give you some overview information from the organizations that they serve. Carrie?
Hello, as she said, explained, I'm Carrie Carr. I'm a senior advocate and outreach manager for Disability Rights Texas. Disability Rights Texas, for those of you who don't know, is the protection and advocacy organization for the state of Texas. We advocate for and protect the rights of people with disabilities. That's their legal and human service rights. We're a nonprofit. We don't charge for our services. Regarding vaccine, we have a program called the Vaccine Access Project. We also started a network of partners called the Texas Partners for Inclusive Access. The goal for both projects is to address the barriers that people with disabilities are experiencing getting the vaccine, and also to provide outreach and education to the communities. Our territory is not just San Antonio or the Bexar County, it's the whole state. So I just thought I'd like to tell you a little bit about what we're doing. We have navigators which address specific barriers that people with disabilities are experiencing, barriers to getting the vaccine. So that's all I have to say. Thank you.
Thank you, Carrie. Next, we have Ashley Lebaye.
Hi, I'm Ashley Lebaye. I'm a board-certified behavior analyst at the Autism Treatment Center, where we provide applied behavior analysis, or as we call it, ABA. And today I will be able to support and help with any questions on specifically how to use ABA techniques when getting your child vaccinated, or really any individual getting vaccinated, especially if they may have challenging behavior, or it's not the most fun to get a shot sometimes. So some different techniques you can use to help with that. The Autism Treatment Center has done a few different vaccine clinics, and so I have had experience with using things beforehand to help prime individuals to get ready for getting a vaccination. We've also done some shaping procedures where we've started with like a pencil and just kind of touch them with the pencil and reinforce using their preferred item and slowly shape that to then them getting the actual shot, as well as just using first then language, reinforcement, really finding things that they like or things they can earn after the fact as well. So that's just a little bit about ABA and some ways that I can help answer some questions today. Thank you.
Thank you, Ashley. Derek?
Good evening, everyone. My name is Derek Nicholas, and I just kind of wanted to talk about a few things from my group. Tonight, my focus will be discussing how to tackle misinformation and how to get people, answer people's questions in a very effective way. What we're trying to do here with the state of Texas in the immunization section, we are kind of taking away from the standpoint of vaccine hesitancy and moving toward kind of pushing vaccine confidence, because a lot of people have questions that, a lot of us did at the very beginning of what happened with COVID. And so through the initiative and some other projects we're working on, and I can discuss it later on, we're really trying to build up the confidence that people should have in vaccines and not shy away from the conversation, but actually encourage it and just have have answers to those questions that people ask. So I just wanted to kind of give an overview of what I can discuss tonight. Thank you.
Thank you. Antonio?
Hi, good evening, everybody. My name is Antonio Martinez. I am the Health and Wellness Coordinator for ACOG's Intellectual Developmental Disability Services Department. I'll be kind of discussing the program that we have, kind of the opposite of what Disability Rights Texas did. Since they were doing the in-home vaccinations, I decided to go ahead and provide outright transportation, since we all want to work together and we want to make sure that we're providing all ends of the spectrum here, so that way everybody has that equal access, that equity. But I'll be talking about accessibility, some of the barriers that we've hit along this road in vaccines and clinics.
Would any of our other panelists like to say a few words before we get started with questions? Okay, here we go. All right, our first question comes to us, was pre-submitted by a participant. What are the latest updates around the COVID-19 virus?
I'll go ahead and take that. We are at a relatively low level. Our community-wide indicator is still low for, I think, at least the fourth week in a row. It might be longer than that. I do see some signs of an uptick, like when you look at the wastewater surveillance that we're doing, or when you look at the percentage of cases that are sequenced that are of that BA2 variant that's more transmissible. We see that increasing. What we don't know at this point is I think everybody anticipates that there will be an increase in cases. What we don't know is how much is it going to go up and how serious will it be. So that's an update in a nutshell.
Does anybody else want to respond to that question before we move on? All right. Our second question was also submitted by a participant. If vaccinated or unvaccinated, what should we worry about? Can anybody like to give that one a shot? Let's see. I think, Nate, you're a community health worker, correct?
Yes, ma'am, I am. So I actually work underneath the immunizations department. And so for the past 2 years, I've been part of the COVID-19 field team that we have. We've tried to assist with, with mass vaccination clinics, and as well as small pop-up community clinics. I guess the one thing that I would say, if there's something to be worried about, I know that some of the research has shown that, the new variants are more transmissible. I haven't, seen too much as far as whether or not they are, more, I guess, I don't want to say deadly, but more, I guess more harmful to individuals. One thing that I can say from working these mass vaccination clinics, it's a lot of manpower. There's a lot of panic. So that would be one thing to avoid by getting vaccinated. If you do decide, that a vaccine is not for you, I think something to focus on would be just keeping your self-protection up, making sure that you wear your mask, that you practice good hygiene, washing your hands, making sure that we still practice social distancing. So just kind of putting into play the things that we've had set in place going forward, and kind of making sure that we don't really take a step back as far as those guidelines go as a community. I think those would be things to focus on, things to look forward to or look at, coming forward as we get more information with these new variants, and as far as it comes with, being vaccinated or unvaccinated.
So I think this is Junda again. I think I heard a question in there that I could answer. As far as we can tell right now, people are not getting sick in a more serious way with the variant, and arguably less so. Some of it, it's unclear whether that's because we're talking about people who have already been vaccinated, already been sick before, or whether the virus is inherently less serious. But I think there's some reason to think that the Omicron variant is not as serious. And on top of everything that Nate said that I agree with, I want to throw in ventilation too. I think we spend a lot of time fussing about masks when masks are not the most effective tool we have in the toolbox. Like, there's a real hierarchy. Vaccines are very effective, and so is good ventilation. So that could be being outdoors, but if you're indoors, it can be opening windows, and it can also be something that you do with a box fan called a Corsi Rosenthal box, but you don't need to know that. But I'll put some information in the chat box about a low-cost way to improve ventilation.
Would anyone else like to touch on, if vaccinated, what should we worry about? Or if, I think we've done a lot of, if we're unvaccinated, anybody want to address what are the concerns still if you've gotten vaccinated?
Well, I think one of the, kind of going back to, what we were talking about just a second ago, I think one of the concerns with being vaccinated, even though we have shown that it's very, good for you, it helps prevent, getting sicker when COVID, does strike in, whether it be in your house or your work. Something to be cautious of also is that, even though we have these awesome vaccines out, there is still a possibility that we can contract one of the other variants. And so I think just keeping that in mind to still, not just view that, the vaccine gives you total immunity, but we still have to keep in place safe practices, for our fellow man, whether it be some of our elderly population, people with disabilities, anything where we can just kind of help our community as a whole. I think keeping that in mind as well for the people who are vaccinated, don't just take it for granted that, now you have an immunity towards it. Still keep your fellow man, kind of in the back of your head there.
Danielle or Derek, do either of y'all want to add in?
No, I agree with everything that both Dr. Wu and Nate had explained.
Okay.
I was going to try to feed a comment to Danielle, but things are moving faster than I can type. But I was hoping that either she or I would just talk about, when we say vaccinated, what we sometimes aren't careful to say is up to date with your vaccinations, because there are a fair number of people out there who've had one dose. And that's if it's a 2-dose vaccination series, that's not enough. And if you have, for most people, 2 doses and a booster is recommended. That's what it means when we say up to date. Thank you.
And that's a beautiful segue into our next question, which is, what does it mean to be fully vaccinated? And can you explain the benefits at each level of vaccination?
Take it away, Danielle.
So what it means to be fully vaccinated is having you completed the series. You got your first shot, you waited the waiting period for the second dose. That's fully vaccinated. And to be up to date is obtaining the booster vaccine. I'm sorry, I didn't catch the second half of the question.
The benefits at each level. So the benefits of just getting 1 dose versus getting 2 dose versus getting also the booster.
So of course, ultimately being completely up to date, you have the maximum effectiveness of that the vaccine provides. You get one vaccine that the effectiveness declines. So that's why we have the second dose. And then of course the booster adds another level of protection. So you have some protection with 1 dose, but you have more protection with the second dose as well as the booster.
Thank you. Anybody else want to chime in? All right. We have 4 viewers who are watching us on Facebook Live. And so I just want to take a moment to invite questions to be posted in the comment section. And we are monitoring that. So we'll be happy to post your questions to our panelists this evening. And that also goes for our participants who are here with us in the Zoom tonight. If you do have a question that comes up while we're doing our pre-submitted questions, feel free to put it in the chat and we will add it into the queue as we move forward. I would like to take a moment and put forward a poll question. I know we just have a few people with us today, but please, everybody, feel free to respond to this question. We're just going to leave it open for a brief moment. The question is, have you and your household been fully vaccinated for COVID-19? A, yes. B, some, but not all. Or C, no. All right. And I'm sharing our results tonight within the scope of our Zoom call. 7 out of 8 of the respondents have been fully vaccinated. 1 out of 8 is in a household where some have been vaccinated, but not all. And now we'll move along to our next question. If someone lives with a disability and is concerned about the impact of the vaccine in relation to their disability, what advice do you have for them to get their questions answered with accurate information?
I would say talk to their doctor.
It really is about making sure when you do get the information, it's from a trusted source. Now, of course, since the COVID vaccine is available pretty much anywhere, that source could be, if you get your shot at Walgreens or CVS, it's okay to ask the question of to pose the question to the pharmacist. If you have a doctor, ask your physician. It's okay to ask those questions. Don't feel like, you can't or you don't have the ability, because the doctors that are serving you are the ones who really have the knowledge to say whether or not, they can't answer all those questions for you. So it's all really about the source. I know some of us have family members and we have people who think they know about the vaccine and they'll give you their opinions about what they've seen on Twitter or whatever, but it really is going to a healthcare provider that can give you a true amount of information. So that's the best advice I can give.
I agree with what he said. If you have a health condition or a disability and you have a specialist or a primary care physician that follows you in your care, I would suggest asking their recommendations. The COVID vaccine is safe for everyone, but if you just have a concern and you need that peace of mind that it is safe for you to get the vaccine and they know your medical history, I would strongly suggest to ask them, a pharmacist or someone with that background that can provide that information.
Anybody else? Okay. Our next question was submitted by a participant. Is the booster shot recommended and safe for everyone with a disability? Are the side effects the same for those with different disabilities?
Yes, it is. The side effects are, they are because your body is learning to rev up its immune system. And so the side effects vary from person to person, but the range of things that could happen, they are the same for people with a disability and for people without a disability. I'm sorry, what was the second part of the question?
Are they safe for everyone?
Are they safe for everybody? They are. There are very few people who, for instance, have an allergic reaction to a component of the vaccine. When we talk about side effects, we're talking about things like pain at where you get the shot, maybe muscle aches, fever. Some people have stomach, like a stomach upset or a diarrhea, nausea, which it's less common. And it usually goes away within a few days. So, that is not necessarily fun. Although it also means that your immune system is working. Some of us with immune systems that are not working as well sometimes have fewer side effects. I wish I had more when I got my vaccine. But it's a good sign. It's a sign that your body is revving up like we want it to.
Okay. The next question was submitted by a participant. Why are there and what can we do to cope with the inconsistencies in mask mandates from transportation and medical facilities to stores and restaurants?
I can touch on this one a little bit. So being out in the community with some of the work that me and my team, we do, a lot of it requires that we canvass neighborhoods, that we reach out to local businesses, as well as just, everyday people interaction with whoever's on the street or, that we come into contact with along the way. And I think one of the things that we can do about the inconsistency, whether it be from the government or whether it be from, the stores or whatever the case may be, is to just be consistent with it yourself. My team, we try to make it a practice that everywhere we go, we are seen, with our city uniform, with our ID badge and with a city issued mask. And so we just want to promote that out there to the community, kind of set the example. And then, of course, let them know that, we have resources for them and we're here to help them if, in any way that we can. But I think just taking that issue upon yourself and having some accountability for yourself and kind of setting that standard and that tone is one way that, we can combat or address the inconsistencies that are around us.
And there was another person. Did that cover it, or do you have some more to add?
No. Nate took the words out of my mouth. That's what I said. You do what's best for you and how you see fit. If you feel comfortable wearing your mask and being consistent with that, that's perfectly fine.
All right. I'm going to launch another poll question. So the next poll question is about resources. Would any of the following resources make it easier for you to get the vaccine? A, no or limited waiting times. B, ABA therapist or behavioral supports. C, sensory de-escalation space. D, universal changing space or an adult changing facility. E, Spanish language speakers. F, low vision support volunteers. G, access to an ASL interpreter and or information in ASL. H, information in picture formats. I, information in plain language. Or J, other, not listed here. Go ahead and check off all that apply. That would make it easier for you to get a vaccination. Give it one more second, and then I'm gonna we still have responses coming in, so I'm gonna leave it open. And gonna end the poll, hit submit if you haven't already. All right. Overwhelmingly, most people said that no or limited waiting times makes it easier. Several would like to see ABA therapists, sensory de-escalation spaces, universal changing spaces, and we pretty much hit the gamut. If you're comfortable and are willing to share in the chat what other resources might have made it easier, I welcome you to do so, but this is a safe space, and if you're not comfortable, no worries. All right. Our next question was submitted by a participant. Are there any mobile vaccine services available that will also provide an interpreter or tactile interpreter to come to the home of a person who is deaf or deaf-blind and unable to travel without extreme duress?
So my program, we're able to cover that if needed. We did contract with a few agencies, but we can definitely find that. And under those circumstances, yeah, that by hands down, we can do that.
And so that resource comes from ACOG, the Alamo Area Council on Governments. That was Antonio speaking. Awesome. The next question, what are some of the barriers you've identified working with people with disabilities, and how has your team worked to reduce those barriers? And I'd love it if everybody on the panel could take a stab at answering that question. And we can just go through the order of our panelists as they were introduced. So we'll start with Carrie.
So, there's so many barriers we've learned through the work we've been doing, which is direct one-on-one with the person calling in who wants the vaccine or wants information. And the Texas Center for Disability Study did a survey, and they found the most barriers were, some of the barriers were needed a ride, needed company, needed to be accompanied to the clinic, needed help with the appointment, the clinics were inaccessible, needed help with consent, lack of accessible parking, needed vaccines at home. And what was the second part of that question?
What have you and your team, how has your team worked to reduce those barriers?
So what we've done is I know that Antonio was talking about transportation. We just cover the whole state. So we try to find resources within their community that can fill that barrier and eliminate that barrier, whether that be transportation, an escort, making others accommodate for this person with the disability so they can get their vaccine.
Thank you. Let's see. Ashley?
Yes. So I kind of talked about this a little bit earlier when I was just talking about what I can be helpful for. So the big barrier that I've come into with the kids I work with is challenging behavior. So if they are engaging in more severe challenging behavior, such as self-injury or aggression, that can be a big barrier for them to get the vaccination if they don't have a support team that can help. And so the vaccine clinics, such as the ones that disABILITYsa will be providing over this next week, are great resources. What we've found and what we've done to reduce those barriers at our clinic is doing some of those techniques I had talked about. So using first then language, first we're going to get the shot, and then they get their most favorite thing ever. Maybe they haven't had it all day, and we save it specifically for after they do the shot. We've also done shaping techniques where we do similar situations at the clinic before they're even going to the doctor and getting the shot, and trying to make it more comfortable for them. Providing support therapist is a big thing. So providing the registered behavior technicians or BCBAs that can go out and help during those situations while they're actually getting the shot. So I will be at the one tomorrow to help support if there are any individuals with challenging behavior. So yeah, the big thing is the first then response is reinforcement for whenever they do actually go through with and get the shot. And then beforehand, trying to work on getting comfortable with getting vaccine or getting shots in general, being more comfortable at doctor's offices. We call it pairing, making it like a funner place to be, making them want to be there. And then just having the support as needed as well, I think is the most important.
Thank you.
We also do, just a side note, I am, and a lot of therapists are certified in specific holds. So we can do, I have had at past clinics have parents just ask me to do a specific hold to help them keep the child like safe and calm, so they can do the shot really quick. So that is another option that some places can also provide if that's something the parent is interested in.
Danielle.
Okay. So I'm going to be a bit transparent. I'm new to my position here at Metro Health, so I haven't really been able to witness some of the barriers personally. I know that we are working as far as to make our services more accessible to everyone. Communication, whether it's and one thing that I'm doing is I plan to increase my collaborations with programs such as disABILITYsa, so I know the resources that are available to people who need it, and provide that education and information to people because not everybody has access to the internet or to find resources online. So I think it's just important to participate in as many community events that I can, and inform the public of the resources that I've learned, and inform them of those services.
Thank you. Antonio, you're up next.
So some of the ways we've kind of addressed barriers, of course, like I say, when I was seeking funding on providing vaccine accessibility, I did see Disability Rights Texas kind of take that mantle and provide the in-home. So again, I took the opposite end and started providing transportation. Unfortunately, we don't cover the whole state of Texas, but the program that I oversee, we cover Bexar County and then ACOG's 13 county service area. So we were telling people, hey, we wanted to make sure you were comfortable. So if it meant me providing transportation from you going to Bexar County to Frio or from Wilson to Guadalupe, I would do that because I want that person to feel safe. I want it under their terms, and I want to make sure that ride is all inclusive to them. Of course, we had those personal care attendants. Should somebody need to travel with them, we had the wheelchair accessible vans as well. And of course, the material that we've developed, we've always ensured that it's done in plain language, that it is 508 accessible. I am very even self-conscious about how many words I put in a sentence and the phonemes of the words that I use in my material. That's just my special education background, to make sure that it is understandable and legible. Some other things we've done, we've gone out to day halves, the day centers, and we've also checked on our guardians to make sure that this is something that they want to do for the person that they are caring for. But that's kind of how we've kind of tackled it, and we've tried to educate it as much as we can to professionals and healthcare professionals with these kinds of workshops to make sure that our population that we do serve is all inclusive as much as possible, and some considerations when setting up a pop-up clinic.
All right. Derek.
I'm going to come from a communication side on this topic. So for us, it was kind of interesting that no matter the audience, the underlying, I'll say the word hesitancy, we saw themes, and people, again, I found it interesting that the plain language choice came in second. And that's kind of what we always are struggling with here, because you have very technical terms and you don't want to get too far away from the technical terms, but you want people to be able to understand exactly what's going on. So taking the information from the CDC and trying to incorporate it and make it attainable to people in Texas over the course of different learning capabilities, it was a challenge, right? So what we did is we looked at it as also an opportunity. And now, not only do we have the initiative with the vaccine engagement the outreach initiative, we also have another thing in the works. It's cross-cultural education modules that will be creating materials so that people can have peer-to-peer conversations about the importance of vaccines. Now, what we're doing is we're partnering with a couple of universities in Texas, and we're creating these modules so that we can allow the conversation to happen in the community, which is very important because the community, you know who your neighbors are, and that's a trusted source. So we're creating these materials, and we're doing the smart thing. We're actually testing the materials with the audiences we're trying to reach. You would go, hey, doesn't everybody do that? No. So we're trying to make sure that, hey, I'm in Austin and I think so, like certain things will resonate with other people. I don't know what happens or what people in San Antonio would want to hear. So or people in the various communities for whatever area they live. So we're creating these tools and making sure by testing them, they can be effective. So that's a big thing we learned from this. And of course, we are still trying to make all of our materials more accessible. We're trying to make sure that people have a connection, whether it be culturally or otherwise, the images we use, the words we use. So all of our publications are starting to have that feel. We're going in different various languages. We at the events with our cross-cultural things, we have our focus groups. We're going to have people there that are interpreters and ASL and having information for blind and low vision. So we just want to be as inclusive as possible because that's our job. So that's what we learned.
All right, Dr. Wu.
But I completely second everything that was said there. As far as other things that Metro Health has done, because Danielle, spoke to us partnering and learning right now at events like this. And also structurally, there are things that we did to increase access early on when it was hard to get a vaccine, for example, by calling everybody on the list of 6,000 to 7,000 people. There's a list that's kept by CPS and VIA that is of people who would need extra help evacuating in the event of a disaster. And so we reached out to offer home vaccinations. But, we're not perfect. I mean, would it have been better to have done that along with targeted education like we're now doing, beforehand? Yes, it would have been. So we're doing as much as we can. I'm not trying to take up too much time, but there are other examples of things where we tried to structurally make it easier for people who didn't have online access or who don't have transportation. And we're continuing to try to improve.
Thank you. Nate, did you have anything that above and beyond that you'd like to add?
So just seeing kind of firsthand, being part of the field team.
Nate, real quick, can you turn on your camera so that you pop up?
I hope my connection doesn't break up. Normally I leave the camera off, but yeah, let me go ahead and turn it on. So pretty much the seeing, firsthand what we experienced was accessibility. So people just having, accessibility to make it to the vaccination clinic, even though we're doing it kind of in a neighborhood area. Some people are limited, to a wheelchair or, they're elderly and they can't walk, they don't have somebody to drive them. So just making sure that we had people on site that could go into the home and vaccinate was a very big point of emphasis for us. Also, as well as just using our local community resources. So, for example, we've done quite a few vaccination pop-up clinics in our churches, and just having the church and kind of, that community back up the city provided a level of comfort amongst that community, which then in turn kind of gave them a bit of a sense of comfort, in being able to trust us and kind of move forward with their vaccination, as well as them providing transportation to some of their folks who are, transportation, challenged. And so just kind of using all those resources was a way that I noticed our team kind of stepped up and were able to administer the vaccine. So those are kind of some of the issues that we saw going on right away at the beginning where, like I said, the education and the accessibility pretty much.
Thank you. We're going to do a round robin one more time with this next question. Some of you have heard it before, and this will be new for others, but what are some of the lessons learned through the pandemic that have resulted in improved practices in your service provision, especially as it relates to services for people with disabilities? And we'll start in reverse order. Nate, you want to start with that?
Can you repeat that question one more time?
Sure. What are some of the lessons learned through the pandemic that have resulted in improved practices in your service provision, especially as it relates to people with disabilities?
So I would have to say education and knowledge of their disability. I know, for myself personally, I know there are multiple disabilities across the board that I'm not familiar with or how to properly assist. So having a disability specialist, is crucial and a great tool that could be utilized. Also, when it pertains to people with disabilities, I also tend to think of hardships as well as a part of a disability. So kind of leaning towards a different end of the spectrum on that. Just being able to have resources readily available. So, for example, like we talked about wheelchair accessible areas, wheelchair accessible vans, having transportation for those who aren't able to, get there on their own, or also having being mobile, being able to send out a registered nurse who can apply the vaccine, in the home of somebody. I definitely think those were all lessons that we learned kind of, in the fire, so to speak, as we were going out into the community. And I think those are some of the main ones that kind of stick with me off the top of my head.
Thank you. Dr. Wu?
Yes, I'm going to sound like a broken record, but the connections that we're making now to use those both in terms of vaccine events, like Nate was talking about, but also I always go to policy and structure and how we can change systems. So carrying this partnership beyond just vaccinations, I don't recognize that's what we're talking about, but for instance, involving disabilitysa in other collaborations around emergency preparedness as we move forward. Thank you.
Derek.
Dr. Wu, you stole my two words. Partnerships and collaboration. That's really what it was about for us. Sometimes, especially working for the state, you can find yourself on an island because two reasons. Either you can't work with you can't work with coalitions because of what's going on. Like you're kind of disconnected from the communities, even though you're trying to serve those communities. And to be honest with you, COVID made us change that. And we, luckily from the CDC, we got the push, the funding that we could actually reestablish those community connections. And we're having conversations now. For example, my staff and I had a meeting with No Barriers Communication. And we talked about how we can work together and how we can make sure that our ads are accessible. And we go beyond just print. It's really about making sure that the integrated communication strategy that I put together for the state makes it so that everyone can understand. Our slogan, our theme is every dose matters. And that's really what we try to get people to know, that no matter what, every dose matters. And this is what we've learned. I mean, we came with that slogan like 4 years ago, but it really does resonate right now. So we just want to make sure that through our partnerships, through our collaborations, that even when COVID it's never going to go away, in my opinion, but whenever it just goes into the fold of standard immunizations, that we don't lose this momentum and we don't lose the way that we're working together. And so that's all I'll say about that.
Thank you. Antonio?
So some of the things that we kind of learned on how to serve persons with IDD or the IDD community is since a lot of my classes were the programs that I do, they were kind of classroom based, or we would go out in the community and do certain things. It shifted, our shift into this whole virtual thing was difficult at first. And of course, the main barrier was making sure that somebody had internet access. So a lot of my focus turned into now the technology aspect, and kind of an old certification back then in the day. I do have my C+ certification, but nobody uses that anymore. But I was able to, a lot of my classes, we got tablets. We sent them out to homes. They had data service. And I was able to remotely tap in and control the webinar for them if they had a difficult time navigating through the tablet, or if a caregiver, like my father, gets frustrated with technology, kind of just throws it to the side and comes back at it later. We wanted to make sure that we were still moving forward with reaching out to our caregivers and the IDD community. I will say one of the benefits from COVID, the silver lining, because I'm more of a optimist, is that it made us really branch out of San Antonio. Some of the close relationships I've now developed is with the American Academy of Developmental Medicine and Dentistry, the National Task Group on Intellectual Disabilities and Dementia Practices. So it made me really reach out past Texas and fill those gaps that sometimes we have here as a state, and bring them into kind of that virtual world and bring that knowledge here, which was, I guess, the silver lining to it.
Thank you. Danielle?
One personal lesson that I've learned from the pandemic is that we live in a misinformation age. I say this because when there's fear, or there, like in the beginning of COVID, there was a delay of information. Misinformation filled the void and it spread. There's a Mark Twain quote that says, "A lie will spread halfway across the world while the truth is putting on its shoes." So I just learned to make sure to be able to provide people with, facts, information, and follow up with where they can find those resources, where they can reliable resources other than the internet and social media, and just resources on where they can find the answers that they're looking for. There's assistance with technology. There's a technology assistant program. So just being able to give people the resources that they need to find out the actual information around COVID.
Thank you. Ashley?
I definitely agree with all the collaboration and connections with other people. I think that's been a really big thing in my field personally, as well as the telehealth. So telehealth was a huge thing that has just really come up in ABA lately, especially with the pandemic, because we weren't able to do services and have the kids come in to the clinic. So we were doing a lot of outreach and doing more parent trainings, more parent involvement over the telehealth. And then with that came that we didn't have enough BCBAs to do all the telehealth sessions. So we actually, Autism Treatment Center has a collaboration with UTSA, and we were able to then get a grant to train therapists and train RBTs to implement the telehealth services as well, which was really cool in our field. And then we also have a lending library too, where we were able to lend tablets, different things to families who didn't have a way to do the telehealth sessions with us. Another thing that has helped us, or a lesson that we've learned, is just prepping in advance for some of these things. So I talked about shaping up, getting kids getting more familiar with getting shots. We also did it with testing as well. So a lot of the kids didn't want to get tested that I work with because it's not comfortable. So we actually would practice at clinic and then reinforce, slowly shape up, going farther up their nose and reinforce with their preferred items. So just doing things more in advance, not waiting until something big like this happens, but just going ahead and prepping kids more in advance for different situations is another thing. And then on top of the telehealth, I would like to include, UTSA does have it's called the BOAT program, and it's a brief outpatient autism therapy where they'll provide 5 hours of free services via telehealth. So I will share that link in case anyone's interested in getting 5 hours of services, whether it's to collaborate on getting your child vaccinated or something different that you would like support, ABA support specifically with. That's something else that has come out of the pandemic, is reaching more families via telehealth. So I will provide that link in the chat. Thank you.
And Carrie? Lessons learned.
Well, everybody has the same lessons that I was going to say. I mean, collaboration, partnership. One of our partners is TCDD, and TCDD is in our network, our Texas Partners for Inclusive Access. And they partnered up with University of Houston of Clear Lake and developed a training, a virtual training for professionals who vaccinate individuals with disabilities. So there's a great need for that. I'm so glad to hear that you're on here and talking about ABA. Technology has been we knew that was a problem, but we would not believe the amount of calls we get. People just don't have the technology. They either don't have it or cannot use it. And so we get a lot of questions about a lot of assistance we give one-on-one, just helping them access technology.
Thank you. All right, so I'm going to launch another poll question. This is around the reasons that people may not be getting a vaccine. And the question is, what are some of the reasons you have for not being vaccinated for COVID-19? A, I am fully vaccinated. B, information is not in a format accessible to me. C, I am not able to get to the vaccine clinics. D, I have fears and concerns about the vaccine. E, I don't understand what impact it will have with my disability. F, I don't know anyone else who is vaccinated. G, I am very sensitive to needles, large crowds, and or loud noises. H, other reason not listed here. Based on our initial question, I imagine we're going to get a very specific response, but we'll give it just a few minutes and then we'll reveal the responses. For those of you who, yeah, that's good. All right, I'm going to end the poll. If you haven't clicked submit, please do so now. And majoritively, we do have people who are fully vaccinated. But some of the concerns that popped up in our group are I have fears or concerns about the vaccine. And I am very sensitive to needles, large crowds, and or loud noises. And as well as another reason not listed here. Again, for informational and learning purposes, if you selected the other reason not listed, please feel free to put that in the chat if you're comfortable doing so. Or if you would like to private message me with that response so that I can include it in our learning experiences moving forward, that would also be appreciated. Our next question comes from a participant. Where do you look to find vaccine locations that provide drive-through or in-car options, as well as those that are wheelchair accessible? And what if I can't find one located in my area of town? Who would like to take a stab at that one?
Well, since we had the drive-through, I guess I should say that we did close that down because of lack of demand. But just like with ACOG being able to arrange things, we also, if you call 311, we can arrange for a drive-through. It's not drive-through. We can arrange for a vaccine to come to you. And if you would prefer that to be while you're in your vehicle, we can do that. If you would prefer it to be in your home, we can do that. And that somebody has helpfully put our pop-up clinic info in the chat box, but those are generally not drive through. Look into my team to see if there's anything they want to add.
Yes, our pop-up locations can be found at covid19.sanantonio.gov. Typically, I actually went with my two colleagues that performed the site visits for the locations that we have the pop-up clinics at. And that is one of their main things they look at in a facility, is that it's accessible for anyone with a wheelchair, that it has a rail. So all the locations have that component for wheelchair accessibility. I have heard that if someone is not able to make it inside the building, they will come outside and give them the vaccine in the vehicle if needed.
You know, I've heard that too. So I'm sorry, I forgot to say that. You're right.
Yeah, and I can just second that. And working with a lot of the pop-up clinics that we have, those are some of the major things that we do take into account. We always have a wheelchair on site. In case somebody needs that assistance, we can get them out of the vehicle into a wheelchair, into the building, get them vaccinated, have them wait, their 15 to 30 minutes, depending on the circumstance, and then we can get them going. However, if somebody doesn't feel safe or comfortable doing that, we do have one of the nurses on staff that can go outside to the vehicle and administer the vaccine there in their car. They will wait with them the time that is needed. And then, like I said, we will get them on their way. So we definitely do try to be as accessible as possible with our pop-up clinics. And then, like Dr. Wu said, you can always find that information on our city website, as well as we have a weekly flyer that we distribute amongst the community. It's also up on the website, but it does have all the locations for the pop-up clinics for that week.
Thank you so much. So at this point in the conversation, we are going to do a transfer out. So I'm going to bid you all good night, but Lisa is going to take the questions forward from here, and looking at some additional concerns and covering reasons and reviewing some of the resources that were submitted by our panelists. So Lisa, take it away. So make sure you click here, then you transition the slides, not over there. Or right here, this question number 14.
Okay. Can you guys hear me okay? Yes, great, perfect. So our next question is, what was a question or concern you've encountered that surprised you around the COVID-19 vaccine, and how did you respond? Anybody want to take that one?
And you said it was just a question that surprised us?
Yes, a question or concern that you've encountered that surprised you around the COVID-19 vaccine, and how did you respond?
For me personally, I think it's just some of the misinformation that goes around, and a lot of it, they seem more funny than actually real. But just some of the things that, the myths that people buy into, whether they hear it from a friend or if they see it on Facebook or, some kind of social media site, just different things, is there a chip in my vaccine? And, I kind of have to tell them, like, I wouldn't even know how the chip would fit through a needle that small, but just kind of, giving them just basic information to kind of debunk some of those myths. A lot of them are very outlandish and very comical at times, but just seeing some of those things that you encounter, they do kind of give you a bit of a shock factor. Like, is that really what's being said out there? And then, kind of just going about it in a calm manner and trying to provide them with facts and, not necessarily, to say, just take it from me, but, I have a medical professional here who can actually break it down for you, tell you, more in depth, of course, than I can. I can give you basic information, general information. But if you need more, in-depth information, we have that on site as well. So I think some of those outlandish, mythological type of statements, I think were something that I encountered. And, like I said, just trying to debunk it with truth.
Would anybody else like to add?
I forgot about the chip. I really tried to forget about that. So yeah, I agree. It's misinformation and it was generational, but it wasn't. So I was surprised by that. Like, it didn't matter if it was someone who was 18 or 80. They still had the same, and they always quoted the same sources. And that surprised me. I would thought that there would be more of a different approach to this, but I think it was a lot about fear, a lot about not knowing. And when you have absence of news or absence of direction, you have other things that will fill it. And so, yeah, I was surprised by that.
Yeah, I would say likewise, it's not surprise. It's that we've been working in this and so that we forget. And then once in a while, somebody asks about, for example, fertility. And I remember all over again that is a myth that has come up, not just with this vaccine, but with, the HPV vaccine, the polio vaccine at one point. Like, this is one of those things that people wield when they're against vaccines because they realize how powerful it is. And since I'm on the topic, it has no effect on fertility. And one, I'm sorry, I'm pausing because I'm thinking about all the different pieces of data that we have that show that. But the National Conference of Catholic Bishops, for example, has come out in support of the vaccine. And I don't think they would do that if it affected fertility.
Would anybody else like to add?
I think another thing that people are concerned with is the ingredients in the COVID-19 vaccines. People, or I guess another misinformation is that the vaccine has the live virus, and in fact it doesn't. And it's just kind of bridging the facts with the myth and letting them know that it doesn't contain the live vaccine. The vaccine cannot give you COVID-19, and just letting them know it doesn't have any of the eggs or latex or preservatives that people are concerned with. So I think that was another thing that came up as a concern.
And I actually forgot a couple of other ones that we still deal with right now. So people are really not trusting mRNA, just the whole mRNA. And they say it didn't go through the usual ways in which the vaccines have to be, tested and proven. And so just the fact that it was new technology, they really didn't trust it. That's number one. And number two, even though we said the vaccine was free, we still get people asking or not getting the shot because they think they have to pay for it. And that's something that from the very beginning to even now, we get that all the time. Just people, and we've always had messaging that says just that. But it's for some reason, either it's not sticking or they're hearing something from other people. But that's the one that has actually surprised me, that everyone has said that this vaccine is free. And there's still some people who think they have to pay for it. So.
But I will say it does not help that the federal funding has stopped for some of these services, but the vaccine does continue to be free at our pop-ups, as well as if you have health insurance. Yeah.
Does anybody else have any other thoughts on that? Okay, I'm going to move into our next question. That one is, what is the number one reason you've come across as to why someone is deciding not to get the vaccine, and what is your response?
So in dealing with a lot of the community, we try to go into some of our low-income communities, communities that we know really need the assistance, really need the information. And so the number one reason, hands down, that I always come across is, number one, it's too new and I want to see what happens to somebody else before I take it. So it's that fear of the unknown for them. That whole idea or concept that because it didn't go through or they think it didn't go through a normal testing, or they don't know what the ingredients are in it, or they don't trust the government or whatever their reasoning or logic is, right? It always comes down to a fear based mechanism where they're scared something is going to happen to them, and so once they see somebody else take it and they see that they're free and clear, that kind of gives them a comfort to say, okay, he didn't die, so maybe I'll give it a try. And that's always the number one reason that I've come across, when talking to people in the community, when trying to reach out to them. And so, I mean, again, just trying to put them at ease and not force it on them, I think has been the most, the best way to go about helping them get vaccinated. Just letting them know we're a service. We're not trying to demand them to get it, but we're here to help them and provide a service to them if they need it, if they're comfortable with it. But that's always been their number one thing is fear, fear of the unknown.
Yeah, and we kind of alluded to this, but all the regular steps were taken in approving this vaccine. It was just in a different timeline because some of the things had already been queued up ahead of time, like some of the earlier studies on animals and this early safety studies on humans. That was already done because there were other attempts at mRNA vaccines before this. And it's been on the market for more than a year. And billions of people around the world have gotten the mRNA vaccines, which is a lot better than you'd get with most clinical trials for anything else. Most vaccines we approve with maybe 30,000, 40,000 participants. We've got billions now. And that's really reassuring to me.
Would anybody else like to add anything into that? Any other thoughts, concerns? No. Okay, I'm going to move into our next poll question. And let's see. This is our last question. I'm going to go ahead and launch it. Our question reads, how likely are you to get the vaccine? A, I'm already vaccinated. B, very likely. C, somewhat likely. D, undecided. E, somewhat likely. Or F, not likely. And go ahead and submit your responses. We'll give it a few minutes. Okay, looks like we have almost everybody on here answered. So I'm going to go ahead and end the poll and share the results. So most of the people on our call here are already vaccinated. We do have one undecided. This is a safe space, so if you feel comfortable, you can send us a message in the chat, just kind of giving us a little bit of feedback on why you may be undecided. Or if you have a question that could pertain to why you are undecided, we have our panelists here that would be more than happy to answer any questions that you might have or anything that we may not have touched on. And then, Dr. Wu, would you like to mention what you just sent into the chat and just talk a little bit more on that?
Sure. As far as the vaccine is new, and if I was just thinking about how 1 year may not be enough for people, right? Maybe they're like, well, I want to wait 5 years. But one of the things about vaccines compared to a medicine that somebody is taking, usually with a pill, you're taking it every day, at least once a day, and it's really getting into your system. And so that's why we tend to see effects after a while. Whereas with vaccines, it goes into your body and then it gets broken down really quickly. So when bad things happen after vaccines, because it's not zero risk, like in the 1970s, there were vaccines that would actually give polio, unfortunately. That shows up soon. If that's going to happen, that shows up within 6 weeks, a lot of times within just a couple of weeks. And that's why I was saying that a year is a really comforting amount of time.
Thank you, Dr. Wu. I'm going to move us to our next slide. We're doing okay on time. Would we like to do a little bit of open conversation with Nate and Charlie if there's anything that you want to touch on, or if we have any members that are with us that have additional questions?
I'm open to the open conversation if that's where we want to go.
Do we have any questions from any of our attendees today that we might not have touched on, or anything that you're still a little concerned or not fully understanding? We're here to answer them.
I have a question, or maybe it's a question and comment. I work with individuals with disabilities, and a lot of times they're not really certain as far as access. As you were mentioning, children with autism, I have an autistic grandson. I mean, I feel like I would like to see if there's an opportunity maybe for disabilitysa to like post the areas where individuals can go get the vaccination. And the reason I say that is because if they most likely will, I think, go to a place to get the vaccine if they're referred by someone who has the same disability or condition that they may have, because they know that if they're comfortable with that resource. Versus, I mean, not that they wouldn't go to the city of San Antonio, but if my friend tells me, oh, I got that information from DisABILITYsa, then, I don't know, they would feel more comfortable about that. I mean, that's just my input.
Yeah, of course. That's great input. Great question. So we actually do have 2 accessible vaccine clinics that we are holding this week. One of them is going to be tomorrow at St. Philip's College from 6 to 8, where we will have ABA therapists. We will have ASL interpreters. We'll have low vision support. We'll have a sensory de-escalation tent that can be used also to get the vaccine if that's a more comfortable space for the person. And then we also are offering the in-vehicle as well, vaccination. So lots of different resources that we'll have tomorrow. And then we'll also be holding one on Saturday from 10 to 12 at Texas A&M. And that is on our website. It'd be great for you to share it with any of your families or anybody that you work with. It is a very safe space for our individuals with disabilities. We're making it extremely accessible for all types of disabilities. So it's a great opportunity if they're looking to get the vaccine to come out and get it in a more comfortable setting for them.
Lisa, can I add to that?
Yes, of course.
So I have just posted in the chat our website. So as part of the Vax-abilitySTRONG program, the very first thing we did was go and do a lot of research on, number one, different resources for information that are already provided by different organizations across the country about the vaccine, put into different communication formats. for the disability community. And then we also started it's the website that has the getthevax.html sign. So that is where we are trying to locate different clinics that are providing services for the disability community. So we do have our 2 Vax-ability-strong accessible clinics that are listed on that website. But we also did identify, we have the city of San Antonio's pop-up clinics, the Metro Health pop-up clinics listed. And we actually found a pharmacy that is working with the Metro Health pop-up clinics to provide services for those with IDD. We found this wonderful nurse practitioner, Joyce Turner, and she said, send anybody to these 2 locations during these timeframes, and I will be there to assist them. So you might come out to our, vaccine clinics this week to get the first round, but you're going to need to go somewhere for the second round and for the boosters, right? So we are trying to provide that on our website. And I also invite all of the organizations that are here today, if you have additional resources or you find something that can be of service to the disability community, please, I've put our email address for our program, Vax-abilitySTRONG at disABILITYsa.org. Please send that to us and we will get it up on our website. I've put up ACOG's transportation assistance. I've put up other tools and methods that can help assist people as they go to get a vaccine. And we're trying to provide a centralized location for those supports and resources. So please do send that our way.
I'm definitely going to share this information because I know I work with some of the school districts, and it's great for them to know, especially when they have children who have some challenges getting, immunization. And I think this is a good resource.
Yes, and I will say one other thing, and then I'll turn it back over to Lisa, is as part of our grant funding, any of the printed materials that we have on our resources page, we have printed out multitudes of copies. And we also have a display table, an information display table that we can bring to resource fairs, and we can bring any of those printed materials out to your communities. It's being paid for through our grant, and we can bring those out as packages that then you can provide to your community as well. We want those tools to be available to you. It's a community resource that's being provided through our grant program.
We did have a question pop up in our chat. It's, how do I encourage a parent who is fearful of getting the vaccine because they have had side effects to the flu vaccine? Is there literature on what is in the Moderna vaccine like there is for the flu vaccine?
It's hard to answer this without knowing what the side effect to the flu vaccine was. If it is, like one of the most common things that I hear is I got the flu vaccine and then I got the flu. The flu vaccine, for most people, it's not the live vaccine. So there are some different reasons that people can that can have this experience. Like it's possibly another respiratory infection. It's possible there wasn't enough time for the immunity to build up. It's also possible that, well, the vaccine's not perfect. None of them are a force field, but they do lower the chance of you being in the hospital or dying. So it's hard, without more information, it's hard to specifically answer that. So the general answer is talk to their doctor.
Does anybody else have any other questions they'd like to push into our open conversation? Okay, Please feel
I think Danielle did, I want to flag that Danielle did put something in the chat box because the ingredients for the vaccine are on the CDC website. And what she's put in is an FDA link, and that probably also has the ingredients.
Yes. Sorry, I was trying to unmute me. Yeah, so I did go ahead and I added the link into the vaccine information fact sheet. And this one is pertaining to the Moderna vaccine. So it goes over the side effects to anticipate who should not get the vaccine, what are the ingredients in the vaccine, how the vaccine is given. So it has all of that information in detail.
Thank you, Danielle. Does anybody else have anything they want to add on that last question?
Just one thing for me. I just want to tell Angela, I'm so glad that she's having that conversation, or she wants to have the conversation with a parent, because again, that's what needs to happen to get people more comfortable. So thank you.
Okay, if there are no further questions, I'm going to move to our next slide. And this is just invitation. We're inviting everybody to come out to our disability-friendly vaccine clinics held by our Vax-abilitySTRONG program with disABILITYsa. We have one tomorrow from 6 to 8 p.m. at St. Philip's College in the Watson Theater lobby. And then we will also have one April 23rd on Saturday from 10 a.m. to 12 p.m. at Texas A&M University San Antonio at Patriots Casa. And like Annette was saying, we do have it completely accessible with all of the resources and materials that are just going to make it completely accessible for everybody. We'll have our sensory-friendly escape room. We'll have visual social stories to help. We'll have our nurse practitioners team who is trained to get vaccines to individuals with disabilities available. We'll be able to do vaccines in the vehicle if needed. So please, please, please come out if you are interested, or if you'd like more information. Please don't hesitate to reach out to any of us or to email, call. We're all here for any of the support that you may need. And then just some of the resources that we've been talking about. We do have those social stories in English and in Spanish available for everybody. If you are needing one or if you'd like one, please don't hesitate to reach out. We also do have it available on our website. We have communication boards for individuals who may be deaf or hard of hearing to communicate when they are getting vaccinated, to communicate with their providers. We do have that transportation outlet as well. Antonio with ACOG is a very great resource for that if you need transportation to come get your vaccine. We will also have a disability information and access line that you can reach if you have any questions or if you need any support on finding a vaccination clinic, assistance with an appointment, connecting you to the support services that you may need, answering any further questions that you might have, or also locating resources. This is a great hotline that you can call. And then we also have Disability Rights is a great resource as well, Disability Rights Texas, where you can learn more about getting the COVID-19 vaccine, or if you need help getting it, there are resources available there as well that can help support those needs. And then these are some of the resources that we have talked about throughout our conversation. These are the clinics that you can find. You can go to covid19.sanantonio.gov/what-you-can-do/vaccination to find clinics in San Antonio. You'll have our Vax-abilitySTRONG resource page on our website, disabilitysa.org. Texas Vaccine Outreach and Education Grant information, our DSHS Immunizations website, a vaccine hotline flyer, and then our case rates and death rates as well. So these will all be available on our website as well as we will add them into the chat if anybody needs or wants those resources. And then just a few more: COVID-19 San Antonio, where you can get information, local resources and assistance. You can go to 211texas.org. We do have that Assistive Technology Act program that we had mentioned earlier, and then the CDC COVID-19 website as well. All great resources to find information. And then some of the contacts of our panelists today from our Texas Department of State Health Services Immunization section. We had Duress Nicholas. His email is there if you would like to reach out to him. Disability Rights Texas, we had Carrie Carr today. Her phone number and her email are there as well. ACOG, Antonio Martinez, his phone number and email are provided. And then from IZSA, from IZ, Danielle Howard, her email is available. And then from San Antonio Metro Health, Dr. Joan DeWoo, with her email there as well. If you have any further questions that we maybe did not hit, or any further questions that may pop up, these are great resources along with us here at DisABILITYsa to reach out to and ask those questions. We are a safe space, so any questions that you may have after this conversation, please do not hesitate to reach out to us. And then just a few thank yous to the City of San Antonio Metropolitan Health District, Disability Rights Texas, and our Alamo Area Council of Governments, who have been great partners in us getting these conversations going, getting our vaccine clinics, accessible vaccine clinics going. We are very, very grateful for you guys. Does anybody have any further comments, questions, concerns that they'd like to add? No. All right. So just as closing remarks, you are welcome to save the chat by clicking on the three dots at the bottom of the chat box. Any questions we were unable to get to this evening will be forwarded to our panelists, and we'll post the responses at disabilitysa.org later this week. A special thanks to our ASL interpreters with vital signs and to all of our panelists today. And please, please, please remember to join us for our disability-friendly vaccine clinics this Wednesday at St. Philip's College and Saturday at Texas A&M University San Antonio. With that, good night, everybody. We are so glad you were able to join us. And please, if you have any further questions, don't hesitate to reach out.